Welcome to another lecture by MedicoMedics. Medical Terminology, Chapter 8, Cultural, Ethical, and Error-Free Usage of Medical Terminology. Now, in this lecture, we will briefly discuss cultural considerations in medical terminology, ethical use of medical terminology, common causes of errors, strategies to prevent these errors, the role of plain language in medical communication, do a practice run, and end with a summary. Now, in this lecture, we will cover the importance of cultural and linguistic considerations in medical communication, the ethical implications of terminology usage, strategies to minimize errors and ensure accurate communication. This will ensure patient care is both respectful and precise. Now, cultural differences can impact how patients perceive and understand medical terms. We have to deal with language barriers, so patients may not understand medical terms if not in their native language. The use of idiomatic expressions, so replacing jargon with clear, universally understood terms. Some strategies then. We can use interpreters when needed. We can tailor explanations to the patient's cultural context. We need to be mindful of nonverbal communication. Now, ethical communication involves clarity, meaning using terms that patients can understand to make informed decisions. It involves respect, meaning avoiding language that may stigmatize or label patients negatively. And of course, confidentiality, ensuring that sensitive information is shared appropriately and respectfully. An example of ethical practice could be to say person with diabetes instead of diabetic. And as well to clearly explain diagnoses and treatment options to patients. Common causes of errors in medical terminology. So errors can arise from, for example, ambiguous abbreviations. Like we mentioned in the previous lecture, we have MS, which could be multiple sclerosis, or it can also mean morphine sulfate. So we need to clarify here. Handwriting issues, so misreading written terms. And this could all be due to a lack of standardization, for example, so using institution-specific terms that others may not recognize. Some consequences of these errors could be delayed or incorrect treatment, even patient harm or complications. Now, some strategies to prevent errors in terminology would be to use standardized abbreviations, meaning following these guidelines. Adopting technology, so using electronic health records to reduce handwriting-related errors. Double-check terms, so ensure clarity when communicating with colleagues. Educating patients, so explaining medical terms in plain language for better understanding. For example, avoid using abbreviations with multiple meanings. And write out full terms when there's potential for misunderstanding. So if it is multiple sclerosis, don't just write MS, but write multiple sclerosis. Now, the role of plain language in medical communication. This, I think, is super crucial because plain language is essential for patient-centered care. We need to replace complex terms with simple explanations. Use visuals, diagrams, or examples to clarify concepts. We need to confirm understanding by asking our patients to explain back to us what they've heard. Some examples could be instead of saying you have hypertension, you can say you have high blood pressure. You can explain to them that MRI is a special scan that shows a more detailed picture of the body. So it's important that when the patient leaves the room, they understand in some ways more about their condition than you do, or at least that there is equivalence between the two. Very often, the doctor may understand something, throws out complex terms that makes sense to the doctor. The problem is the patient doesn't exactly understand what's going on. So they leave your office having heard you will have a high risk of developing CHF. And the doctor might have said congestive heart failure, but you need to break that down. What does that mean? What is congestive or congestion, etc.? Because if we leave the patient, or if the patient leaves with uncertainty, in today's age, they will immediately turn to their phones and start Googling. And maybe there is a slight risk of CHF. But when they put it into a computer or a Google, they start coming across all these catastrophic potential consequences. And that could create unnecessary anxiety and confusion, etc., leading many times the patient to come back just to have this clarified. And the amount of time and resources that takes, well, you get the point. So make sure that that patient understands what is going on. And very often, this will be the case if you are using simple terms to explain whatever it is. It may be a very complicated disease or disorder, but if you yourself understand it as a doctor, you should be able to explain it using simple explanations, metaphors, etc., using visuals, just to clarify. And then have your patient explain back to you what all of this means. Now, let's do some quick practice and application. So rewrite the following terms in a more patient-friendly, respectful way. For example, non-compliant diabetic could be patient prefers not to take insulin. Another one, hyperlipidemia, high cholesterol levels. Hysterical patient, patient is experiencing heightened emotions. Morbid obesity, patient has a high BMI that may affect health. And now then, let's end with a summary. So cultural sensitivity and ethical communication builds trust and understanding. Avoiding errors ensures accurate and safe patient care. And that's the end of this lecture series. Thank you for listening.